All right, time for us to cross over to Turkana. We have able team on the ground. This Senate Mashinani is in the region. Earlier on, we had various committees on the Senate engaging the health stakeholders as well as the security organs in the region. Kamche Menza is on standby. Kamche, good afternoon.
Well, good afternoon to you, Irene Muchuma Odim, back in studio. Like you said, we are in Turkana County. Where I am exactly is at the TVET Center in Turkana, where right behind me is the National Senate Health Committee that is meeting various stakeholders to debate on two very crucial bills. The first bill is on Facility Improvement Financing Bill 2023, and the other one is Primary Health Care Bill 2023. But the issues around this particular bill have brought on board various stakeholders from the national government, from the county government as well, from various unions as well as international partners. But without me preempting a lot, allow me to invite the chair of this particular committee, that is Uasin Gishu Senator Honorable Jackson Mandago, to actually expound on this particular bill. You are now debating the Facilities Improving Financing Bill 2023. What exactly is it, and how will it exactly benefit the Mwananchi?
Thank you very much. First and foremost, let me say that the Facility Improvement Financing Bill is a critical bill that is an enabling legislation for the rollout of UHC. This bill is going to enable facilities at the lowest level, at level 1, to be able to retain funds collected at facilities and also utilize funds that have been directed to those facilities at the facility level. As opposed to what has been happening in the past, funds would be collected in counties, health facilities, even at level 1, and therefore that money would then end up at the county revenue account, and you would only requisition through the county budget. Now, for us to be able to roll out UHC, we need provisions to make sure that whenever the service is required, or whenever there is shortage, or there's an urgent procurement that needs to be done at the facility level, then some resources should be available at the facility level. Now, it's not just about the resources going to be available at the facility level. It's also about how is that or those resources going to be managed and accounted for. So the bill is providing a very broad perspective of how the resources can be raised, collected, utilized, and accounted for. And for the whole purpose is to make sure that our facilities are not lacking. Wherever they need small procurements, they should be able to do at the facility level.
There's an issue that NHIF representative spoke about, that is the CEO, on matters of there are disbursements that are being down to counties already, but there is no utilization, indicating or rather citing Nakuru County as having done the highest utilization at 69%. What exactly does it mean? Does it mean that other counties do not know that there's such kind of a disbursement?
Not really. I think the example the CEO is talking about is that what Nakuru County has been able to do is accredit most of their facilities. What it means for other counties is that they are offering services that NHI would otherwise have reimbursed. But because their facilities are not accredited, then there is no mechanism to claim for that money. So what should counties then do in the first instance? They must make sure that all their county health facilities are accredited. Now, once they are accredited, when they give those services like maternity, then they are able to access the reimbursements from Linda Mama. When they offer services that are NHIF catered for, then they can claim for reimbursements from NHIF. So without accrediting the facilities, you cannot have a mechanism of getting the reimbursements from NHIF.
Is it in the bill?
It is now in the bill. All public facilities will be accredited, and that will now enable the rollout of UHC. So you see, why we are doing national legislation to enable UHC is so that we have a uniformed approach, not leaving any county behind. You know, it's now not going to be optional whether county facilities are going to be accredited or not. They are going to be accredited automatically because of this law. In terms of provision of service, no county or facility will be offering less than the minimum that will have been prescribed in the package. And that means, for the first time in this country, Kenyans will be able to access a certain level of service uniformly across, because we are talking about equity, we are talking about access, affordability. So the purposes of all these bills is to create an enabling environment and facilitate that equal access to healthcare.
Thank you so much, Chair. I will engage you for more shortly, but for now, allow me to hand this particular broadcast to our anchor in the studio, Irene Muchuma Odim, if you can hear me. Of course, we'll be making a comprehensive report to inform our viewers later in the day. Back to you in studio, Irene.